Hello everyone, welcome back to my channel. So here are some questions, part 2 of psychiatric questions. The most therapeutic environment for the client with bulimia nervosa would be one that is controlling, focusing on food, empathetic, based on realistic limit. And the answer is most therapeutic environment that is based on realistic limit. A phobic reaction will only occur when the person thinks about the fear object, observes the guilt of the feared object, introject the feared object into the body, comes into contact with the feared object. So, phobic reaction comes into contact with the feared object. A person with an antisocial personality disorder has difficulty relating to others because the person has never learned to count on others, empathize with others, be dependent on others, communicate with others socially. And the answer is antisocial personality disorder, mainly they cannot communicate with others socially. A disturbed client starts to repeat phrases that others have just said. This type of speech is known as repeating the phrases, echopraxia, echolalia, autism, stammering. And the answer is echolalia. I think it is repeated previously. The nurse should observe the autistic child for a sign of not wanting to eat, crying for attention, catatonic like rigidity, enjoying being with people. And the answer is not wanting to eat. So when a child doesn't want to eat, it can be a sign of autistic child. Communication ties the people to their social surrounding, physical surrounding, materialistic surrounding, environmental surrounding. Communication ties with social surrounding. The extremely important relationship that influences the formation of personality is peer, sibling, heterosexual, parents of the child. And the answer is relationship influences, that is parents of the child. One of the major behavioral characteristic of children suffering from attention deficit disorders is overreaction to stimuli, continued use of rituals, retarded speech development, inability to use abstract thought. And the answer is overreaction to stimuli. The emotional balance of an individual always needs family, work and play, security and social recognition, biologic satisfaction and social acceptance, individual recognition and group acceptance. The emotional balance of an individual always individual recognition and group acceptance. The problem of separation anxiety initially occurs during oral stage, anal stage, phallic stage, latency stage. It is oral stage. In the process survives to development, the individual maintain, protect and enhance normally the integrity of the self. This is accomplished through the use of personal mechanism, defense mechanism, denial, acceptance. And the answer is defense mechanism. So the individual can maintain, protect and enhance normal integrity to the self. A person seeing a design on the wallpaper perceives it as an animal. This is an example of delusion, illusion, hallucination, delirium. It is illusion. So, design on the wallpaper looking like an animal. Another term for superego is conscience. The ability to tolerate frustration is an example of one of the function. It is ability to tolerate frustration. Ego, superego, none of them. It is ego. Photosensitization is a side effect associated with the use of lithium carbonate, methylprednisolone, chlorpromazine hydrochloride, methadone. And the answer is chlorpromazine hydrochloride. Abrupt withdrawal from barbiturate use could cause a person to experience illusion, seizure, postural hypertension, sleep apnea. It is seizure. Which of the following statements related to endogenous depression is wrong? It is also known as biological depression, It is more common with women. It is more serious than other type. It is commonly occurring in the high class society. So it is commonly occurring in the high class society is wrong. What is common between marijuana, ganja and charas? All are hallucinogens, all are natural mind expanders, all are derived from cannabis plant, all above are right. So all are hallucinogens, natural mind expanders, and they are derived from cannabis plant. Narcotic Drugs and Psychotropic Substance Act was introduced in India in 1930, 1857, 1985, 1987, and the answer is 1985. Which of the following is not a psychiatric emergency? Not A. Suicide attempt, violent patient, dementia, crisis condition. So it is dementia. Which statement is not true about suicide? The suicide rate in India is 10 to 15 lakh population. Suicide is more common in married couple, more common in middle class, common in men. So suicide is more common in married couple is not true. A chronic organic mental disorder characterized by an impairment of intellectual function, memory and deterioration of personality with lack of personal care is delirium, dementia, psychosis, neurosis. So it is dementia, impairment of intellectual function, memory. A condition in which a person maintains the body position which he is placed. It is a symptom observed in severe cases of catatonic schizophrenia. This condition is known as catalepsy, cataplexy, catharsis, clang association. So maintains the body position which he placed. That is catalepsy. A common manageable side effect of neuroleptics is hypotension, tachycardia, unintentional tremors, dyskinesia. Side effect of neuroleptics, that is unintentional tremors. The most advantageous therapy for a preschool age child with a history of physical and sexual abuse would be play therapy, family therapy, individual therapy, group therapy. It is play therapy. When providing group therapy, the nurse must focus on personal feeling affecting behavior, thinking of the person, mind of the people, behavior of the individual. So, in group therapy, the nurse must focus on personal feeling affecting the behavior. Mentally healthy individual can be defined as those who pay attention all the time, work with mind, free from any mental illness, are able to meet their own basic needs. So mentally healthy individuals are able to meet their own basic needs. A client is undergoing alcoholic detoxification. The client asks if attendance at Alcoholic Anonymous is required. The nurse's best reply would be, "You'll find you will need their support. Do you have feeling about going to these meetings? No, it is best to wait until you feel you really need them. Yes, because you will learn to cope with your problem." So, do you have any feeling about going to these meetings? Autism can usually be diagnosed around the age of 2 years, 4 years, 6 years, 6 months. And the answer is 2 years. When helping a very confused elderly client, the best approach is to provide an environment with a specific routine, group involvement, trusting relationship, activities that are varied. So, when you are helping a elderly client, a trusting relationship is important. Most serious complication of ECT is fracture, tongue bite, dementia, respiratory depression. And the answer is respiratory depression. A schizophrenia patient thinks that other patient wants to kill him. The symptom is known as delusion of grandiosity, delusion of persecution, delusion of nihilism, hallucination. And the answer is delusion of persecution. Swinging of mood between depressive stage to manic stage is known as depression, mania, bipolar mood disorder, unipolar mood disorder. And the answer is mania. Suicidal tendencies are more common in which depression? Autogenous depression, individual depression, homogeneous depression, psychotic depression. And the answer is autogenous depression. Delusion is perception disorder, thought disorder, attention disorder, personality disorder. And the answer is thought disorder. Which of the following is a symptom of depression? Retarded thinking, retarded psychomotor activity, depressive mood, all above. So retarded thinking, retarded psychomotor activity, depressive mood. These all are the symptoms of the depression. Lithium therapy is contraindicated in cardiovascular disease, renal disease, pregnancy and lactation, and all the above conditions. Answer is all the above conditions. Lithium therapy is contraindicated. Benzodiazepines are also known as anxiolytics, hypnotics, anticonvulsants, all above. And the answer is all. It comes under anxiolytics, hypnotics, and anticonvulsants. Major side effect of antipsychotics is extrapyramidal syndrome, neuromalignant syndrome, both extrapyramidal and neuromalignant, allergic reaction. And the answer is both extrapyramidal and neuromalignant. Atropine sulfate is injected prior to ECT because it reduces oropharyngeal secretions, it blocks vagal nerve to relax muscles, both A and B. And the answer is both. It reduces secretions as well as blocks the vagal nerve. While preparing care plan for a suicidal patient, priority is given to self-esteem, safety, sleep, hygiene. So suicidal patient, so safety is important. The most common type of hallucination found in alcohol withdrawal patient is visual hallucination, tactile hallucination, auditory hallucination, gustatory hallucination. Alcohol withdrawal, they will have tactile hallucination. The most common cause of delirium is cancer, drug intoxication, impaired hearing, heart failure. And the answer is drug intoxication. Alcohol withdrawal patients should avoid milk, coffee, orange juice, eggs. And the answer is coffee. Incidence of anorexia nervosa is common in women 12 to 20 years, men who are going to college, women after 30 years of age, men before 20 years. So it is more common in the women who are of 12 to 20 years. An act of crime is not to be punished if it was done by an insane. This rule is known as Indian Mental Health Act, Indian Lunacy Act, M. Norton Rule, British Lunacy Act. It is M. Norton Rule. According to IMHA, a mentally ill person is not allowed to manage property, sign his will, cast his vote, all the above. So it is all above. Defense mechanism in which a person attributes one's own feelings to others is known as fantasy, regression, projection, repression. Answer is projection. Who is known as the father of American psychiatry? John Weir, Sigmund Freud, Carl Jung, Benjamin Rush. And the answer is Carl Jung. National Mental Health Program was started in India in 1982, 1987, 1997, 1993. It is 1987. Narcotics 1985, National Mental Health Program 1987. NDPSA is related to rights of the patient, hospital policies, admission or discharge of mental patients, narcotic drug regulation. It is a narcotic drug regulation. What is the level of preventive medicine that deals with the rehabilitation and return of a patient to a status of maximum usefulness with a minimum risk of recurrence of a physical or mental disorder is called primary prevention, secondary prevention, tertiary prevention, none of this. Level of preventive medicine that deals with rehabilitation, that is tertiary prevention. Physical and mental dependency over any specific drug is known as narcosis, psychosis, epilepsy, addiction. It is addiction. Which part of the brain is first affected in a drunken person? Cerebellum, pons, medulla oblongata, cerebrum. It is cerebellum. Amnesia is, so it is, we all know it is loss of memory. So that's all for the psychiatric questions. For the upcoming videos, please subscribe to this channel.